In recent years, kidney disease has become a public health crisis. This is according to Dr. Luya. When I was very young, I was diagnosed with focal segmental glomerulosclerosis, or FSGS for short, because yes, I know it is a mouthful. In this presentation, I am going to inform you about what exactly kidney disease is, what treatments there are for it, and hopefully, if you're able to, how to treat it. What is kidney disease? Chronic Diseases, an Encyclopedia of Causes, Effects, and Treatments, describes kidney disease as simply the kidneys not doing their job. The job of the kidney is to filter our blood and fluid out, get it out of the system, make sure our blood stays clean, and get waste out of our bodies. The kidneys regulate our blood pressure, and also they provide a number of minerals and nutrients to our body. What are the symptoms of kidney disease include ankle and around the eye swelling, weakness, chest pain, decreased mental sharpness, high blood pressure, leg cramps, respiratory and sleep problems. According to the Kidney Foundation, 37 million Americans have chronic kidney disease and million more are at risk to get it. However, there are treatments possible for the people who have kidney disease. Medication to maintain the kidney function for as long as possible are available. Some of these medications include prednisone and Celcept. Low salt, low sodium diet is also very important, along with low potassium and low protein diet. Physical fitness is also a very important tool in treating kidney disease. The healthier our bodies, the easier it is for our bodies to fight to make sure we stay healthy as long as possible. Once our kidneys have reached end-stage renal disease, more extensive treatments are necessary. Dialysis is one of those treatments. Dialysis is when our bodies are hooked up to machines that either clean out our blood or clean out the fluid. There are two types of dialysis. Hemodialysis is usually done on the arm. We are hooked up with needles and then tubes to a machine, and it cleans out our blood, and this usually takes between 2 to 6 hours every other day. And the other one is peritoneal dialysis. Peritoneal dialysis is when we have a tube inserted in our stomach, and then every single night we get hooked up to the machine, and while we're sleeping, it cleans out the fluid and puts new fluid in. This will usually it's done every night and it takes almost the whole night. Kidney transplant is also a treatment for kidney disease. Kidney transplant, however, requires a lifestyle change. And while it does improve our lifestyles, it's important to maintain the health and have our kidneys live for as long as possible. We do this by taking medication every single day for the rest of our lives, or as long as we have our kidneys. This medication is called our immunosuppressant medication. This is so our bodies doesn't reject the kidneys and then we get sick. However, no treatment will last a lifetime, and the most important thing we can do to hopefully prevent kidney disease is stay healthy. It is also important for us to be proactive and, for whoever it's possible, prevent kidney disease. For some people, if you're born with it or if you have genetic conditions, it's impossible to prevent kidney disease. For other people, however, it is possible. The most important way to prevent kidney disease is to manage diabetes. According to Dr. Dauguirres, diabetes is the number one cause of diabetes. High blood pressure is also a big part of people getting diabetes. That's why it is also important to manage our high blood pressure. Drug use, smoking, and toxic environmental hazards are also a big cause of kidney disease. The reason for this is because our body is ingesting toxins that in turn damage our kidneys. Injury is another way that kidney disease can happen. If the injury is bad enough and it damages the kidney and the injury is not treated, it could lead to scarring, which will then affect the kidneys. Again, diet and fitness are also very important in preventing kidney disease. Low sodium, low salt, low potassium, low protein diets are always important, and fitness. Again, the healthier our bodies, the less likely we are to get sick of anything. It is possible to live with chronic kidney disease. Everybody needs to make sacrifices, and it is a lifestyle change. I hope everyone has learned about kidney disease, what it is, how to treat it, and how hopefully to prevent it. Also, I hope that you learned something, and if anything, take away just how important our kidneys are and how important it is to take care of them by taking care of ourselves. Thank you.